The thing that I want more people to think about is that your egg and your sperm, particularly sperm because it's produced more frequently in the body, are like a snapshot of your current health. And then when those two things meet and they make a baby, that's the creation of those two pieces of health in a way. So even though some people get very lucky and just get pregnant easily and it's no problem, why wouldn't you want to prepare ahead a little bit to make sure that you and your partner are the healthiest versions of yourself before making a baby? And that's where acupuncture can come in with like diet, lifestyle, herbs, just especially for patients of mine that are older, making sure like what are just some simple things we can be doing and taking to improve egg quality, similarly with sperm qualities.
Welcome to the Pure Wellness Podcast, where we talk about what it takes to live a holistic lifestyle by making conscious, healthier choices. Our hope is that these discussions will inspire you to strengthen your daily practice to improve overall physical, mental, emotional, and social well-being. Pure Wellness Podcast provides information solely for educational purposes and is not intended to be a substitute for professional medical advice, diagnosis, or treatment. I'm your host, Johanna Altman, founder of One Body Medicine, avid health enthusiast, and mother of three. Join me and industry professionals as we explore human potential in the pursuit of pure wellness. Hi, everyone. Thank you so much for joining me today. I have a very special guest, Natazia. And I'm so excited for our episode today because we're going to be talking about acupuncture and how that can help with natural conception and fertility. So, Natazia, for those of us who might not know who you are, would you mind spending a few minutes giving us some background?
Of course, yeah. I'm Dr. Natazia Stolberg. I'm an acupuncturist and an herbalist. Most of my days are spent in a clinic doing acupuncture, but also supporting patients with herbs and diet and lifestyle. I have been doing acupuncture myself as a patient for over 15 years.
Wow.
Incredible. At least every other week, sometimes weekly. So I'm really practicing what I preach. And I've seen the amazing benefits of acupuncture. And I really found this field because when I was in high school, I was diagnosed with endometriosis. Which is a condition that now I think people know a lot more about, but still isn't talked about enough. Just results in really painful and debilitating periods. It took me years to be diagnosed. We had no idea what was going on. And I was finally diagnosed at 17 and rushed into a surgery to like remove the tissue that grows through endometriosis. And I was really promised that this would be my relief of pain. Like you get the surgery, you'll be good to go. And that's not what happened at all. I think maybe 2 or 3 months after the surgery, which was a recovery in its own, I started having period pain again. And we went back to my surgeon, who I always like to say is honestly one of the best in the world. He practices at Stanford and he developed the surgery. And that's just important to say because the surgery I had was perfect. But there are a lot of other factors that go into pain from endometriosis. And so the surgery just wasn't a fix for me. And it isn't for, I would say, like at least 50% of people. And when I went back to him, he was like, well, we could just do the surgery again. Like he didn't really have any solutions. The surgery was one, and the other was to be put on this like hormone shot that basically would put me into menopause. I was 17. I was like, this is
wild.
Not an option for me.
Yeah.
And I honestly was just like a curious teenager on Google. I'm like, what else could work? And I found that some women were using acupuncture for pain. And I asked my parents and they were like, neither of them had done acupuncture. And we weren't in like a particularly like holistic family. Like it was new to all of us. And we thought it was worth a try. And I started going to my acupuncturist and she literally changed my life. Like I would crawl in there in pain from cramps and I would leave and be fine.
What an amazing story.
It was really cool. Yeah. I mean, just like I said, life-changing. So I continued managing my pain and honestly do up until now. I never had another surgery, didn't take birth control, like all of those options that they kind of tell you are the only other options. I've just been able to control the pain through acupuncture and herbs for all these years.
Amazing.
Yeah.
What a story.
Yeah.
So I I like the fact that you touched upon Western medicine and how it seems pretty limited in some of the solutions that they provide their patients, and that you had that curiosity and determination to not really settle for them, to be more of an advocate for yourself at such a young age, and look into other forms of medicine and traditional Chinese medicine, which is very interesting because when I think acupuncturist, I don't think of a beautiful young doctor. I think of my Chinese man, my traditional Mr. Miyagi type, right? Which I think we briefly touched upon, maybe why acupuncture hasn't crossed over so much into mainstream. It's, people are curious about it. But me personally too, I've done acupuncture. I have a story with that as well, but I never felt the connection to my practitioner. And what you're bringing to the table, I think is amazing because in the short period of time we're talking, I feel very connected to you. And talk about that more with your practice and how that connection with your patients is so important in being able to have them trust these various treatments that you're recommending.
I think it's important to say that there's no right or wrong. And the schooling that I've been through and the things that I've learned through Chinese medicine are also through practitioners where this knowledge has been passed down through generations. And I think it's so valuable. And I do think that, again, different patients are just looking for different things. And, a practitioner who's coming from Taiwan or China probably knows more than I will ever know about acupuncture because of that ancestry and the way that they learn. However, I do think there is a place for practitioners like myself where I feel very connected to the patients and the demographic that I see, which is essentially me, people who have been bloated before, have been stressed before, who have had painful periods. I've been through a lot of the things that I help my patients with. And there's also a part of, like you said, connection, but also education, where it's I'm not just this being that's treating this patient. I'm helping them understand why these things are happening in a way that they can understand and also integrate into their lives while still having fun and eating fun foods. And, it's not so rigid, black or white. So,
for me too, I see the benefit in that, in being able to make acupuncture a continuous practice of mine. I want that connection.
Yeah. You want it to be fun. For me,
Absolutely.
when I go to acupuncture, it's the best part of my week. It's what I look forward to. And that's how it should be, which sounds crazy for people who haven't had it because you're I'm having needles stuck in me. How can this be relaxing? But it really is. You should leave feeling good and having hopefully learned a little something from your practitioner or have it be this sustainable part of your life that feels great.
Yeah, I agree. Let's dive more into some of the principles, the core principles of traditional Chinese medicine. What is qi? How does the approach of medicine with acupuncture and herbs look different than maybe if I were to go to my internal medicine doctor?
Huge question. I think at the most basic level, Chinese medicine, and I also like that you differentiate acupuncture from Chinese medicine because it's really just one of the tools in our tool belt. There's so many different things and modalities within Chinese medicine, but Chinese medicine is based off of the theory of a balance of yin and yang and the smooth flow of qi in our body. If you have those two things, you will be healthy, your body will be resilient, and you can kind of take on the stressors of life. Of course, you can boil that down into much more specific patterns and causes and all of those things, but acupuncture is mainly working on the qi system, which is very similar. I think the best way for us to think about it is the blood that's running through your veins and arteries, they pass throughout your entire body. Similarly, the channels or the meridians that we work off of have invisible qi or energy moving through them. They feed our organs and, again, different parts of our bodies. If there's a blockage somewhere or there's not enough energy, that's when we start to get symptoms. And so those are the things that we're looking for to treat. And every organ or meridian has associated symptoms where you can tell me these 3 seemingly random things that for Western doctors are well, you go to this doctor, this doctor, this doctor. But for me, I see that's one pattern. I find the root cause and I treat that. And so the acupuncture needles are in most cases, kind of breaking up those like blockages or strengthening those deficiencies so that we have energy flowing to every part of your body.
And I like the whole body approach, which I think Medicine 2.0 is, with information more widely available, people are understanding that for so long we've been treating symptoms and there are all kinds of medications with 100 side effects. And now we're kind of going back to simplicity and treating the whole body. Yeah. So I really love that.
Yeah.
So let's get deeper into fertility and how you are able to help treat patients that might be going through this amazing part of their journey in their life of wanting to conceive. And I'm sure you're like me, where I've met so many couples that are having a challenge conceiving.
Yeah.
And there was this statistic that I read that 300 to 400,000 IVF cycles are performed every year just in the United States. When should a couple come to see you? And what does a consultation for fertility and conception look like with you?
So this is not to discourage people coming to me at different phases of where they're at. However, the most ideal, I think that's fun for us to talk about, especially if there's a young listener who either maybe just got engaged or just got married or whatever it is, and they want to start thinking about having kids. The perfect place to come is either if you are on birth control and you want to start, weaning off of it basically and have someone guide you through that process and start basically bringing back your natural hormone cycle. Or if you're not on birth control, just coming in to understand, where am I at? I think there's, of course, the acupuncture and herbal portion of my practice, but also like the education portion, which most of us didn't receive. A lot of us were just like put on birth control for whatever the reason was. And if not, most people don't really understand like what's really going on with our hormones and ovulation and how does that relate to your period. Things that are kind of basic, but we don't know.
That was me.
Yeah, it's crazy. It's really crazy. You can be from, just any part of the United States or the world, really, any family, any education level, and we just don't know these things. We're like, what is ovulation? When does that happen? Like textbook says day 14, so it must be that. Like, there's so many things to learn. So I like to receive a patient at that time where they're like, I think I want to have a baby in the next 6 to 12 months. Like when that comes in, I'm like, music to my ears because there's no stress involved.
Yeah.
Like they're just starting to think about it. And best case scenario, we start kind of unpacking. We maybe do some blood tests to see where their hormones are at. I love having patients track their BBT or their basal body temperature, either through like a thermometer. Now the Oura Ring can do it for you automatically. It gives us information every single day on like if you're ovulating, when you're ovulating, what are your relative amounts of estrogen and progesterone in your body? Like, it's so cool to see. So I usually just start putting women on that. I'm like, buy an Oura Ring, just start tracking. Time is the thing that we want.
Amazing.
Yeah.
I mean, that's different than the ovulation strips because with that, I feel like you have to guess, right?
And you can start doing those as well as like extra data. But if you don't even kind of know when you're ovulating, like you're testing every single day, like that's a whole process. And I like the mindlessness of like, just wear this ring. And some patients who feel more anxious about the process, like, I'm like, don't even look at it. Just like, let me look at it when you come in and I can see what's going, there's different levels of like what people can take because it can become very like neurotic. And we don't want that.
And stress is not good for pregnancy.
Yeah. So my point in being like why you start early is because say we find something a little bit weird, it just doesn't make as big of an impact on you when you're not trying to get pregnant in that exact moment. Like if I were to tell you a year before you're trying, like, oh, your ovulation's really late, we got to move this up. You would just think, well, I'm really happy I'm here and we're going to do that. Versus if you're trying to get pregnant that month, it just hits different and it causes so much stress. And then we're like trying to weed through all of that, which we do. And I do. I have patients who come in who want to be pregnant yesterday. But ideally we set that all up and then we get their cycle to a place that's beautiful, like pain-free, normal bleeding, they're ovulating, they understand their cycle length, all of that. And in some cases I just release them after like usually 2-3 months of seeing them. I'm like, come back to me when it's closer to the time that you want to start trying. And for those patients that we do that, a lot of them get pregnant like within the first few months of them trying.
Oh my God.
Because there's no stress. you know?
Amazing.
So that's ideal. But of course, people come to me, like I said, already really wanting to have had a baby and they haven't been able to, or they're within IVF cycles. Like those are things that I'm meeting patients where they're at depending on when they're coming to me.
So how can acupuncture support somebody who's already gone through maybe egg retrieval, or because, I went through that personally. I harvested eggs and I was getting older, and my husband and I decided, let's harvest eggs, let's fertilize them, let's freeze them just in case, because when I had my first pregnancy, I was already 36.
Okay.
And, it becomes more challenging. Nobody tells you how challenging it is to get pregnant. It's always, protect yourself and make sure you're responsible. And then it's time and it's a whole nother world of what did I miss? I wasn't educated on this.
Yeah. The egg is available for 24 hours in a month. Like it's not easy. You really got to understand what's going on.
That's right.
Or just be really lucky, I guess.
That's right.
Yeah.
And so during that time when I was having to inject myself with hormones and take fertility pills, my body was just in a state of, it was definitely not balanced. And I felt emotional, and I had all of these things, going through my body. How can acupuncture help reduce stress, bring a sense of calm? I definitely wasn't calm. And I'm sure most of the listeners who are listening to this can understand not feeling themselves. So how can acupuncture help that?
I think when people come in, my first question always is like, what role am I playing? Right? Like, are you just here because you want to relax? Are you here because you maybe want to avoid another IVF? Like there are different places where I can play that role. If you're in the middle of a cycle, especially for egg retrievals, like you said, the hormones are so intense. You're feeling not like yourself. Your body doesn't look like itself. It's also producing so many eggs that it's like not natural to be doing this. I think we're lucky that we have the technology, but it's not natural. Mm-hmm. So ideally, again, I start seeing a patient before that even happens, so that we're also working on egg quality, working on sperm quality. That's something we can talk about. Mm-hmm. And then as they're going through the retrieval process, making sure that the ovaries and the eggs are getting really good blood flow, because acupuncture has been shown to improve circulation in both the uterus and the ovaries. And then honestly, most importantly, after the retrieval, just trying to flush those hormones back out and like reduce bloating. So many women are getting this hyperstimulation syndrome where like you look 6 to 8 months pregnant.
I actually had that, and it was very, very painful.
Horrible. And acupuncture can like in a session or two just like deflate all of that, which is incredible.
Yeah, I had no idea, and I wasn't able to use that as a tool, unfortunately. Let's talk about the quality of the egg and sperm and how acupuncture can help that, and what parts of the body treat that or help that.
So if you're going through IVF, or if you're not, just trying to conceive naturally, the thing that I want more people to think about is that your egg and your sperm, particularly sperm, because it's produced more frequently in the body, are like a snapshot of your current health. And then when those two things meet and they make a baby, that's the creation of those two pieces of health in a way. So even though some people get very lucky and just get pregnant easily and it's no problem, why wouldn't you want to prepare ahead a little bit to make sure that you and your partner are the healthiest versions of yourself before making a baby? And that's where acupuncture can come in with like diet, lifestyle, herbs, just especially for patients of mine that are older, making sure like what are just some simple things we can be doing and taking to improve egg quality. Similarly with sperm quality. Sperm is like made new every 60 days. So it's so easy to manipulate. Even if, a partner has had a sperm analysis and everything looks fine, I'm always like, well, great, we can make it even better. And that's going to impact not only getting pregnant naturally, but also through the IVF process. Like the healthier the egg, the healthier the sperm, the more healthy embryos you're going to get. And I think that's a missed part where they're just kind of like, well, it's fine, so it's fine.
It is actually. And when we talk about the topic of infertility, we don't really assume that maybe it's the male sperm.
Yeah. It should be tested right away. I always have my patients do that. I'm like,
Exactly.
Why wouldn't they? At least then everything is good. And if it's not, I mean, some of my patients, female patients, are being poked and prodded for years and their partner was never even tested. I'm like, why not?
That's horrible.
Yeah. Like it's so simple. It's
Yeah.
like the easiest part of the process, really.
That's true.
Yeah.
So when we're talking about quality of egg and sperm, are you treating that patient with both acupuncture and herbs? Or
Usually.
It's both.
Yeah. There are some cases when somebody is already in an IVF cycle, I won't use as many herbs because the hormones that are being used are arguably like, they're just 100 times stronger than anything I could be doing with herbs. And I'm like, we're already down that course. That's fine. But we can do herbs before, or like diet, nutrition things before. There's some basic like vitamin packs that are good for men to be taking. And then also if there's something specific, like their motility is low or their count is low, then there's specific herbs you can be giving to help with that, which is just, the results are amazing. It's so easy to like retest after 2-3 months and see how much better. And then in women, I've seen through different supplements and herbs and acupuncture, honestly, that the amount of follicles they're getting through an IVF cycle, all those things are just increasing.
That's amazing.
It's great.
It's amazing. I've never really, until, doing more research into your practice, realized how beneficial acupuncture is for fertility.
Yeah. It's not talked about enough. I think it's always just like pain, like you have a bad back and you should get acupuncture, but this to me is way more interesting. So,
It really is. In terms of, let's say now a couple comes to you, they're pregnant. Do you recommend the mom coming in, and how often?
Again, perfect scenario is like seeing them through the entire process. But I do have some patients who come, maybe it's because they have morning sickness and like that's how they're introduced to me. I think first and third trimester are the most important. First, because there's so many different changes happening in our bodies. Morning sickness, constipation, like fatigue, all these different things that we can really easily address with acupuncture with no side effects. Second trimester, I should also go back and say women who have had like recurrent miscarriages and things like that, acupuncture and herbs can be so powerful in that case and also in reducing stress during that time. Second trimester, I feel like most women feel good. They're like, oh, I'm like have energy again and I'm, not too big yet. And it's like I can kind of resume my normal life. And then third trimester, they'll really come back to me, typically first and third trimester on like a weekly basis, to help again with like they're starting to have some pain, they're not sleeping well. And then around week like 36, 37, we're starting to prep for labor because acupuncture can reduce labor time and pain.
Oh, wow.
Reduce inductions, which obviously then reduces the chance of a C-section. So there's like that whole portion of it as well, which is incredible.
That is amazing. I've never thought about that. We had talked briefly about my experience with acupuncture, 32 weeks being pregnant with my twins, and my daughter was not growing. Her head circumference wasn't growing. Her stomach circumference wasn't growing. And my perinatologist told me if she doesn't grow next week, when you come in and we measure her, we'll have to deliver. And for me at 32 and a half weeks, I was really worried about it. It's not time. For twins, I think it's 37 weeks is full term. And so I started seeing an acupuncturist twice a week. So I did that for 2 weeks and she grew each week that I was seeing my acupuncturist.
You can't make these things up. It's crazy.
And I was able to deliver her and my son at 34 and a half weeks, which was still premature, but not,
not 32.
32 weeks. So I
blood flow.
It's all that blood flow and that chi, right?
Yeah.
So I wanted to also ask you, my introduction to you was from a very good friend who was pregnant with her second son. And she said, you have to talk to Dr. Stolberg. I have the best experience with her. And when I was pregnant with Wyatt, she was able to flip the baby. And I said, what? I said, I've heard of doctors being able to do this. And typically it's during delivery or right before delivery.
Yeah, like a manual. Yeah.
Like a manual flip, I guess is what you could say, but not during acupuncture and prior to delivery. So when she had mentioned this to me, I was floored and shocked and amazed at the same time. So how do you do that?
Yeah, so it's done through burning this herb, which is mugwort, and in Chinese medicine, it's moxa, and we use it on all different parts of the body. Honestly, it's fun to kind of go back and think about before needles were a technology. It was burning moxa and bloodletting were like how they did Chinese medicine, how they like put heat in, took heat out of the body. And so you burn this herb not on the skin, but near the skin. So it's heating on the outside of the pinky toe. So random, but it's the end of one of the channels, the urinary bladder channel. And when you do that, it flips the baby. You have to come early enough where the baby is like small enough and can actually turn. And of course, it doesn't happen every single time, but we were talking about I've flipped like 5 or 6 babies in my career, which is
amazing.
Crazy. Yeah.
If you could flip one, I want to hear about it.
Yeah, exactly. And it's better than the alternative of either having to have a C-section or, like you said, like having them manually flipped, which is not comfortable. So you burn, like I said, this herb, and I typically will teach patients how to do it because you have to do it on a daily basis and they can't come see me every day. And so I teach them how to do it or their husbands how to do it. And I think the friend of ours that we have in common, I think she did it for like less than a week, multiple times a day, and texted me that the baby flipped.
So she had to do it herself?
Yeah. It's like there's different modes. There's like little stickers that have it, or like this big cigar like looking thing that you just kind of like move around the pinky toe. So it's really easy. It's almost like.
Is it the right or left or both?
Both.
Okay.
Yeah. Yeah.
That's
the
so
key
wild.
Also is like once you feel like they could have flipped, you stop and you go get checked because they can't.
They're gonna flip
they
over
could
again?
keep moving. Yeah. We don't want that. We don't want to flip them back. But no, it's a miracle when it happens. It's
That's
so cool.
so wild.
Yeah. So it's always worth a try. The moment you find out your breach, you should find a local acupuncturist and go see them and have them help you. Because worst case scenario, it doesn't work and you're in the same situation that you were in before.
That's amazing.
Yeah.
God, I wish I had utilized acupuncture more and I had more education on the benefits of this during pregnancy.
Yeah.
Now, what about herbs? How do you feel about utilizing herbs during pregnancy? I know we had talked about increasing egg and sperm quality through the use of acupuncture and herbs, but herbs are really strong.
They are.
So how do you feel about using them? Do you use them during pregnancy, or is that a time where you kind of stop?
I'll use less during pregnancy for sure. The first trimester, there's a formula that I really like that I'll prescribe, especially if somebody's having a recurrent miscarriage like we talked about. So they typically will be on that formula already. And then when they get pregnant, I keep them on it as it can help prevent miscarriage. That's kind of the situation that I use herbs in the most. Like they're already stable on that formula. Of course, I have them talk to their gynecologists and send them all the information on what they're taking so that there's like multiple approvals. Of course, we go through courses of like what's safe to take, but I always like patients to feel like, okay, everybody is on board. And then after the first trimester, they'll typically stop that formula. And then there's usually not many formulas that I think are worth taking, like that the risk the benefit outweighs the risk, where we could just be doing acupuncture, which is really safe. And then formulas kind of come back into play postpartum. There's some that really help with milk production, which is super important and so simple to fix. Again, like if women just knew they could go to acupuncture for like pain, cysts, low milk supply.
I feel like, hindsight's 2020. I had no idea.
Yeah.
And I actually was trying to produce milk for 2 children, which is not natural. And I was having a hard time. I had to go on fenugreek and some other herbs.
Yep, that's a Chinese herb.
Is it?
Yeah,
I didn't know that.
Yeah.
And I had
Did it work?
It worked.
Yeah.
I mean, there is this brand, I think it was called Cash Cow or something.
Okay.
And it worked.
You're willing to try anything.
Gold. I was willing to try anything. But I didn't have a lot of guidance, unfortunately, even with a lactation consultant. So walk me through. Now I have this beautiful baby with my husband. And immediately after delivery, do you recommend the mom coming in? Because, we're now experiencing, or I'm meeting a lot of moms that are having postpartum for whatever reason. A lot more. The acupuncture, I think, can help restore all of that.
Yes.
Right?
It's arguably one of the most important pieces. for all of my patients I'm seeing, I will schedule them like 2 to 3 weeks out from when we think they're going to give birth. And I'm like, you need to come back. And this is still one of those things I try my hardest to tell them how important it is. And they all get busy and they're all like, I don't have time. And I'd say like 50% listen to me and the other 50% come back like 6 to 8 weeks later, falling apart. And they're like, I should have listened. I'm like, I told you. I told you. When you have just had a baby, you've grown another human inside of you and given them all of your energy. And then either giving birth or having a C-section is hugely traumatic. You lose so much energy, so much blood. You have to actively restore that. If you don't do anything, if you think like, oh, I'll just bounce back, you won't. And if you don't really feel it, I see it a lot with people then trying to get pregnant the second time and they have issues because they're still depleted. So ideally they come back 2 to 3 weeks later and we just start like re-nourishing. And also during the time that they were pregnant, we talk about foods to eat, how to recover postpartum, warm foods, keep yourself, like all of those things that feel very traditional, but they are for a reason, they work. And then depending on the situation, again, because most of my patients are breastfeeding, I'll try to avoid herbs if I can, aside from a few, and just do it through like diet and nutrition because that's super safe for them to like re-nourish. Lots of bone broth, lots of meat, lots of cooked veggies, rice, like things that are just really hearty.
And wholesome.
Mm-hmm. And it's honestly simple. Like it's really, people think it's this crazy science. When deciding what to eat postpartum, I just actually trying to conceive and postpartum, I try to say, okay, imagine you're in a cabin somewhere cold. Mm-hmm. Like what would you eat to sustain yourself? Those are the foods you want, like hearty, warm soups that are cooked and just filled with nutrients versus like a lot of my patients come to me like on the St. Bart's diet that are just like fish and like they're eating nothing really, or like very light, cold foods. And that's not what we want when we're trying to get pregnant or afterwards. So you have to really shift your mindset.
So you're mentioning the difference between warm and cold food. I just want to dive deeper into that.
Yeah.
So how does warm, comforting food help prepare the body?
Yeah. So
for more fertility.
Foods can be actually like physically warming or they could be energetically warming. So like something like ginger, even if it's a ginger juice, is energetically warming. You drink it, you feel the heat, same with like spices. So we want everything, especially around conception and if you are having, even like period pain, things like that, or postpartum, everything to be warm. I just think women should be warm all the time. Like there are some exceptions, but socks on your feet, heating pad, having warm, nourishing foods that essentially by cooking them are already pre-digested. So when you eat them, not only are they warm for your belly, and not shocking to your system, but you can just absorb the nutrients so much easier because it's already pre-done versus like a smoothie or a salad. Like your body's working hard to get
that nutrient. Yeah. That makes sense.
Yeah.
I never really thought about that.
And if you only have a certain amount of energy, which all of us do, you can decide how you want to spend it, right? So if you're trying to get pregnant, why are you spending it on like warming up a smoothie when it could be going to your ovaries?
That makes sense. And I guess that goes back to the philosophy in traditional Chinese medicine of utilizing that energy, that qi, more efficiently.
Exactly. For the thing that you want.
Wow.
I know. Which also it plays into the role of stress, which we touched on slightly. Stress is a form of, moving energy into a different part of our bodies that is not helpful for fertility. So for example, when we're in that like fight or flight mode, which can happen even just from mental stress, our bodies think like, oh no, I might need to go run from a lion right now, or I don't have enough food or whatever it is. And like blood is going to our muscles and our brain and not to our uterus or our ovaries. We don't want that. Like we want our bodies to feel safe and the energy to be going to the places that we need.
So yeah, stress is also very important, I think, to be mindful of, a practice of mindfulness, especially maybe if a couple has gone through multiple cycles of IVF and it's very difficult emotionally to take yourself out of the experience, the trauma.
Yeah.
So just even seeing somebody like you to help calm them and ground them.
Yeah, even if it's just that 1 hour of that week that they are maybe not thinking about it or thinking about it in a more positive light, it's better than nothing. I know better than to say like, don't stress about this. Like, it's
we're going to stress.
We're going to. But the biggest thing you can ask for is just to try not to really like try to put your body in a state where your body feels like, oh, I'm safe enough to have a baby right now. because it doesn't really understand like what our stressors are and that they're not dangerous for a baby. Our bodies are just like, we're stressed. We don't know what's going on. Why would we have a baby right now?
Yeah, that's amazing. So I really love the fact that you have a strong focus on women's health and reproduction and just overall hormones, and which we could talk about in another podcast.
Endless,
but hormones are such a huge part also of, getting our body where the yin and the yang are in balance. And I'm sure just from talking with you, acupuncture and herbs help with all of this stuff.
Yeah.
This is amazing.
Yeah.
Is there anything else that you wanted to add, maybe regarding what couples should be paying attention to besides stress levels and, food? I think we touched upon food and mental, lack of mental stress is important.
It is. Yeah. I think, again, like we're talking about these things in a vacuum. And when I say food and stress, like none of us are perfect. I think it's just like trying to make choices that feel supportive and really looking at a lens through the lens of nourishment for your life. Like that's what I try to get all my female patients to think about. Because they're like, can I strength train? Can I run? Like, what can I do? What can I not do? And I'm like, that's really up to you. If you work out in a gym and lift weights and you feel nourished and grounded after, great. If you feel exhausted after, maybe not for you. And everyone's body is different. So I want people to kind of go through the things they do on a daily basis and have that thought. Is it exhausting me or is it nourishing me? And always choosing nourishment, especially in terms of if you're trying to conceive.
Yeah, that makes sense. And not just doing things because you're anticipating, I'm going to gain weight, or, this is what I normally do for me, because now you're doing things for that baby.
Completely different. Yeah, our goals are very different. So you have to shift that. Yeah.
Amazing. Well, thank you so much for shedding light on your practice and how you can help couples and, women in general feel better about their bodies.
Of course. Yeah.
And I enjoyed having you here.
Thank you so much for having me.
Of course. This podcast is sponsored and brought to you by One Body Medicine. You can learn more by visiting onebodymedicine.com. That's the number 1, bodymedicine.com. You can also follow the show on social media under the handle Pure Wellness Pod. Thank you for listening, and we'll see you next time.